I thought we'd start with just what is the current status of COVID? I think so much around the war, and of course, we have so many different places to get information. You probably have the most current knowledge of what's going on with COVID. Give us a kind of update on where America stands in their fight against COVID.
Well, sadly, we have just surpassed the 1 million death mark in the United States, and you can't not acknowledge that first and foremost. But fortunately, uh, as the uh, as the COVID-19 virus has continued to mutate, it's become less virulent, thereby making people less sick. But it's become more contagious, which has kind of been a two-edged sword, David. It's a mixed blessing. A lot of people got infected during the Omicron spike around Christmas, New Year's, and since, which conveyed a great deal of natural immunity. People acquired natural immunity that way, even natural immunity on top of those that were vaccinated. So even stronger immunity. But people didn't get as sick with the Omicron variant. And as we move through the Omicron variants now and through BA point two and beyond now, the patients are not getting as sick, which is just fantastic.
Can you explain to us what do you think it was that you all did that kept the rates down, that kept the severity of COVID down throughout this pandemic, and how can other people potentially implement some of these things? Because it is a scary world, and it's like just like when you think you're getting out of it, there's a new story that there's a new outbreak, and I'm at a conference now in Atlanta, and like you just feel so you lack confidence to be out at big social gatherings. It's really anxiety provoking.
So I guess the answer is, David, we didn't allow our clinical decision to be altered by the political process. We stuck to the science, and we've done that from day one. And it was really scary because I've been a mainstream physician. I'm actually a child and adult neurologist. I'm a brain specialist. I did my fellowship at UNC at Chapel Hill. And I'd always been a mainstream medicine doctor. And all of a sudden, I saw myself being labeled as on the fringe doctor, and that was very odd and very weird to me because I'd never been there. But yet I was doing what I was trained to do all the way through fellowship. Because as a child neurologist, if we wait on a child indication from the FDA for a drug, we could be waiting a decade. So we have to have discussions with patients' parents about off-label use, and those are the same discussions we had with our COVID patients about off-label use. And I had people ask me, why didn't you publish your data in a scientific journal? And it's because our protocol adapted and changed as we learned more and more and more about this virus. And so we were on a warpath fighting the virus. We weren't trying to produce publishable data. We were trying to save people's lives every damn day. That was our goal.